I would like to thank AMP for allowing me to be part of this year's virtual AMP. The topic of my talk today is angiosome-directed access for optimal results. So I will talk about angiosome concept, and then I will talk about the accesses, different sort of accesses utilization for patients with CLI. So what is an optimal result? We have to define first that. Is it symptom relief or wound healing or prevention of amputations? The concept of angiosome in a nutshell is trying to recanalize the vessel, which gives the maximum flow to the affected area of the foot to get the maximum healing. The purpose is to concentrate on the vessel, which is going to give us the best results by healing and preventing amputations. So this is one of the cartoons. You can see that anterior tibial artery is usually the dorsum of the foot here, and you can see posterior tibial artery is purple, and this comes and gives foot, the heel flow, and then this is a combination of peroneal at this area. So this kind of gives us an idea which part of the foot is supplied by which vessel and where we're going to be focusing in our intervention procedures. Let's give you some example. Here you can see this patient has these toes gangrenous. So when you look at the angiogram, our focus is, first of all, is this anterior tibial artery, which is totally occluded, has other diseases, vessels, but focus is on the wound-directed access and intervention. Here again, you can see that this is our toes and anterior tibial arteries occluded. So this is an angiosomal concept. Where is the disease and what vessel is the culprit vessel? Contrary to that, the heel area, you can see that the posterior tibial artery is occluded. Actually, there's not much flow to the heel. So our focus is going to be recanalating this posterior tibial artery. Now, a patient can have a multi-vessel interventional disease where you can see there's a lot of disease everywhere, and you take a look at the vessels, there are many vessels that are occluded. So we have to, in this case, be more aggressive in opening more than one vessel. Again, here you can see the same thing. This patient has many wounds, and again, if you look at the angiogram, all the vessels are occluded below the knee. So we have to go and try to open as many as possible. Now, let me talk about access. What are the different accesses? What is the ideal access when we talk about? So the ideal access is which takes you to very proximity to the lesion, which improves your pushability, trackability, torqueability of the devices. Your tools can reach to where you want them to reach with safe and minimal complications. There are different types of accesses depending upon where the lesion is. Could be contralateral femoral access. It could be ipsilateral antegrade access versus retrograde, and most of the time it's a combination, antegrade plus retrograde accesses. Now, this is up and over common femoral. This advantage of this access is that you can have a large 7, 8 French sheets can easily go, and this is very good for iliacs and proximal SFA occlusions or disease vessels. Antegrade access, which is much more commonly utilized for CLI patients because most of the disease is infrapopliteal and tibials and distal SFA. So this gives you a direct accessibility to those tibials, improving your, as I talked about, pushability, accessibility, going all the way to the pedal loop. Devices will have no problem. These are some of the other ones. This is antegrade distal posterior tibial access. It could be utilized for a pedal loop reconstruction. And this is a mid SFA antegrade access, could be utilized for certain conditions. So retrograde access, so when we talk about retrograde access, we are talking about distal SFA, popliteal, and again, tibial vessels. This is one of the examples of a distal popliteal access in the anterior fashion. This is a knee joint, and this is just between the bones going retrogradely from here. And here, this is a distal SFA access going retrograde. The purpose is not to move the patient, stays supine position, and we just utilize these accesses depending upon where the pathology is. And these are the accesses from the tibials, anterior tibial artery, peroneal, and this is posterior tibial artery connecting to this fluid, TAMI fluid with heparin, nitroglycerin, preventing spasm, thrombosis. This is one of the examples I like to give. 59-year-old gentleman with CLI. His angiogram shows occlusion of the anterior tibial artery, which corresponds to the pathology, and has a 2-vessel runout, but as you can see that you can't even see the dorsalis pedis. Pedal loop is not complete. So the procedure was started antegradally, getting an antegrade proximal SFA access, going down into the occluded AT with the support catheter, CTO wire, unable to get through to it. We utilize the concept fail fast. If it's not working, don't spend too much time. Go to your next access. And in this case, unable to get through, so went under ultrasound, dorsalis pedis, anterior tibial artery access. Now, distally, as you can see that access was obtained, a sheath was placed. So giving an idea about the accesses, here you can see we have an antegrade access, 6 French sheaths, unable to get through. So, and then we got a retrograde access to the anterior tibial. So this is angiosomal directed access. It could be more than one. Purpose is to cannulate the angiosomal vessel, which gives us the best results. So going retrogradely and antegradally together, as you can see that getting gradually proceeding forward, and then I was able to get through to this vessel, and the rest of the procedure was done antegradally. This is balloon tamponading, the access side, and you can see here, subsequently, these are the final images. There's a recanalization of the anterior tibial artery. Very good results. Now you can see the pedal loop is complete. Good flow through the digits are noted. So we would expect a very good outcome in this case. So in conclusion, angiosomal directed interventions lead to improved outcomes. It has been shown many, many times. Appropriate access provides maximum benefit to the patient in successfully crossing the lesion and providing inflow, direct inline flow to the affected area. Thank you very much.